quick evidence-based tools that you can use to manage those anxious pregnancy thoughts that come up. Number one is scheduled worry time. This is a technique from cognitive behavioral therapy. Okay. And what you do is you actually schedule every day, every other day, you schedule worry time. And the wonderful thing about this is in the time, in the non-worry time, you have an anxious thought pop into your mind. You look at the clock and you're like, you know what? It's 2 hours until my worry time. I'm going to push that aside. I'll worry about it later. What are we doing here? Think about it. We're increasing the amount of time you spend in the blue, yellow end of the spectrum. That's what we're trying to do here. So just maximizing that amount of time. And then you can have your worried thoughts during that elected time as a beginning time and an end time. Okay. This works for people. Okay. Now, another evidence-based technique for managing anxiety, particularly when you're feeling a lot of, anxiety in your body, is a hug. I know it sounds super, super cheesy, but it really is about getting out of that fight or flight and into the rest and digest, the parasympathetic nervous system, just turning the dial down on that nervous system. We are social creatures. Children and babies, they don't do well without touch. The same is true of adults. We need that touch to tell us that we're safe. Of course, this is with a safe person, a person that you have trust with. And we see that hugs can lower blood pressure, lower heart rate, and improve mood. And another tip that I'll give you, if you've got, worried thoughts and anxious thoughts that are popping up and you feel like going to Google, if there's somebody around who can give you a hug first, it's a good idea to calm your body down first, because when we start searching on Google, we oftentimes won't stop searching until we feel like this relaxation of our anxiety. But does searching on Google or doing anything on a computer really ever relax us? Unless you're on the Calm app or some kind of app like that, oftentimes, that's not going to happen, right? Unless you've got a special place that you're going. Google is not that special place. Okay. So do a hug before you do a search. Okay. Okay. And then finally, another quick tool, kind of quick-ish tool, is approach and acceptance. And this is something that I learned from Dr. Dan Siegel and Dr. Cassidy Freitas. And it's a really more of a concept. And if you're a member of Sterling Parents, you've probably heard me talk about this with you before. So it's really about not fighting the anxiety. I get messages from members of Sterling Parents all the time. How do I not be anxious before my first appointment? I'm like, the first step is to not try to not be anxious. So this matters to you, whether you're trying to conceive or you're pregnant. This stuff matters to you. Worries and anxieties are going to pop up. So it's about, when you have that anxious thought, saying, you know what, it makes sense that you're here. This matters a lot to me. I care a lot about this. I'm not going to not have these worried thoughts. So it's about approaching those thoughts and having warm acceptance and being kind to yourself. Okay.